So if you're comfortable with it, and you want to interact, we would love to have you on camera. If you're somewhere, sometimes I know people are like crammed in little hallway areas and people are walking behind them. That's totally understandable. Also, just make sure, unless you're asking a question, to please mute your computer, because there's often a lot of background noise, because I know that this is the evening, so folks aren't in necessarily a quiet area. But again, we welcome you to our Career Networks panel tonight. Career Networks is part of the Center for the Business of Health. We have a few facets within it, our Learn, Explore, and Connect. And in those, we have wonderful panels such as this, fireside chats, where you can really start to explore a little bit about, the healthcare ecosystem. We have grab and go materials. And then we have an option where you can connect with our, some of the folks that are actually on here tonight, but then many of our partners across campus and beyond. So we're just so fortunate to have our wonderful panel and also the audience members attending tonight. We will have some questions, kind of moderated questions, but please feel free to raise your digital hand at any point in time. And every couple of questions, we're going to stop and ask you all if you have any questions. So there'll be ample time for you to ask any questions that you wish of our panel, but we're going to start tonight first by having our panelists introduce themselves. Again, this is our Digital Health, Technology, and Health Innovation panel. So I'm going to go ahead and start as I see on my camera. I'll have Mike go ahead and start, and then Katie and Delphis. If you all would just do a brief introduction of yourselves, and then we'll get started.
Great. Thank you, Suzanne. Evening, everyone. It's an honor to be here and share my journey in digital health with you. My name is Mike Rawaan. Now, I'm a tech guy by training and education. My journey started in the late 90s when I got an associate's degree actually in communication technology. And I started working with a lot of small companies building local area networks and HTML websites. Some of the kids have to look that up, what HTML is. But I quickly transitioned from technology into product development, where I shifted focus toward development of tech solutions in healthcare companies. And during that time, I also went back to school. I did double major, got 2 bachelor's degrees in information systems as well as business administration, and then ended up in Carolina to do my MBA and graduated in 2012. As I advanced my education, my career path has also evolved, going from managing projects and products into leading product development, ultimately leading strategy for healthcare organizations. I've been very fortunate, I would say, in my journey, because I've been able to work with most of the segments in healthcare. As we know, healthcare is substantially large segment, about $4.1 trillion now. But I've been pretty fortunate to work with healthcare providers, payers, pharmacy, healthcare services, and of course, healthcare tech. Currently, I'm a principal consultant at a firm I founded nearly 6 years ago. We're called Covalence Health. And we work across the healthcare industry, again, across all the subsectors of healthcare, where we help organizations with growth strategy, transformation, product development, partnership, and raising capital. Most of our clients are actually in the digital health space. So we're pretty fortunate because we get to work with a lot of these organizations that are sort of on the cutting edge, that are the startups that are trying to do something more disruptive, and what I will categorize as a largely archaic industry. So once again, thrilled to be here and share my journey with you. And Suzanne, back to you.
Great. And I'll pass it on to Katie.
Hi, everyone. Yeah, Katie Morgan, excited to be here. Looking forward to having a discussion tonight. And to give a little bit of a background, I went to UNC for undergrad and studied business at Keenan Flagler and Spanish as well, and was really interested in entrepreneurship and kind of the nonprofit space. Worked for a primary care pipeline startup when I was an undergrad and kind of that summer after too, and that really piqued my interest in healthcare specifically. So that got me started on a healthcare route, bounced a bit through some nonprofit work, and then most recently, before my current role, was working for UNC Health, the system in strategic planning there in their kind of internal consulting role. And then while I was there, I got my Master's of Healthcare Administration from Gillings. So a double Tar Heel over here. Definitely love UNC, have deep North Carolina roots, having grown up there as well. But I'm currently based in Boston and working for a health tech startup here called In1 Health. And I'm an account director at In1 Health, and we're on the like social determinants of health side of healthcare.
Terrific, thanks. And Delphis, round out the group, please.
Oh, awesome. Good evening, everyone. It's such a pleasure to be here with you all, and thank you so much, Susanne and Erin, for the kind invitation. So I'm Delphis Vera. I'm originally from Lima, Peru. I'm a trained physician epidemiologist, and I was part of the 2019 full MBA program cohort. I've been in different areas within the healthcare domain. Early in my career, I worked for a military infectious disease research institution as a research scientist, mainly running public health research. But within the institution, I transitioned to public health and medical informatics, working alongside IT teams and software developers to kind of bring informatic solutions to public health challenges, such as remote patient data collection, electronic disease surveillance systems, and tools for monitoring and evaluation programs. Right after I transitioned to clinical research, working for a multinational pharmaceutical company, managing phase 3 and phase 4 clinical trials in Peru, in Chile, and Ecuador. And that actually sparked my desire to acquire more formal managerial tools, and that led me to come here to the States, to UNC to get this MBA program. Most recently, I led the data analysis and business intelligence efforts for an early stage startup company that basically focuses on collecting patient feedback data and providing insights and recommendations to improve patient experience and provide some sort of on-site service recovery. Currently, I'm leading efforts in building data products and patient registries at Labcorp. It's Laboratory Corporation of America Holdings. And I work under the digital business transformation and strategy team. This team resides in the IT organization, and we are focused on key strategic innovative projects on the IT side, and basically trying to provide much better experiences to our patients and customers. So that's me. Thank you, and I'm very excited to be here with you all.
Terrific, thank you. And we're glad and just very thankful that you have taken your time, all three of you, to be here with us tonight. I'm going to start off with a question that I think is applicable, because this is such an emergent and kind of dynamic and diverse vertical. I think we really would like to define it for a lot of folks who might be kind of new to like digital health and some of these other areas. So from your perspectives, what defines digital health technology and health innovation in today's healthcare marketplace? Again, from your perspective. And again, we can popcorn around, so chime in, anybody.
I think I can just go ahead. I think digital health, it's gaining a lot of momentum, and it has been shaped by many different factors in the past 20 years. For example, the digitalization of health records, the use of wearable devices, interoperability between systems, telehealth and telemedicine, and the introduction of smart devices like smartphones, and as well as huge advancements in science, among many others. But I believe digital health, it's mainly being defined by its promise to achieve many different things, like, for instance, improving access to healthcare, reducing the inefficiencies in the healthcare system, improving the quality of care, lowering the cost of healthcare, And this is mainly by promoting preventative behavior, which is the keystone for public health, right? And also providing more personalized healthcare for patients. So there's plenty of evidence out there that the use of digital medicine or digital health allows patients to better track their own health and wellness. So this is a very exciting moment in time in which I think digital health and the application of information technologies are right, rising up top, and I think you are in a great place to start exploring getting into this area.
Yeah, I can add a little bit to that. I thought that was a great description of it. In my mind, I would divide it up into three categories. There is one category which I will call, which is the digitization or automation of healthcare processes. So you think about your electronic medical records, your revenue cycle management, existing processes that can be automated and be made more efficient through technology. Another piece is analysis and informatics, and this one has so many subcategories because we can go into decision support systems, we can go into more accurate reporting, we can go into some of the new technologies that we're starting to see evolve, including automation of a lot of what I would call clinical decisions, which is a little risky, but that's off topic. And then the third piece is hardware, right? So we've talked about wearables, for example, but it doesn't just end there because we also have things like being able to monitor a heart failure patient from miles away, being able to allow individuals with type 1 and type 2 diabetes monitor themselves and be able to take medication and take their injections when they need to. So those are the three categories. And each of those, there's so many other verticals. And to Delphis's point, each of these is growing, and it's growing tremendously right now. There's plenty of opportunity. And each day as technology evolves, even in other spaces, one of the things that we're starting to see as a consulting firm is more and more organizations are trying to apply that into healthcare. So we have things that are happening, for example, in the financial sector. How can we utilize that technology in healthcare and make healthcare more efficient and hopefully cheaper?
Yeah, and then I'll just round that out. I appreciate both of those responses. And I guess I think about it sometimes pretty simply of how can we take all of this data that we have and do something good with it and do it really well. And I think that's where I see kind of the industry hopefully heading, of being able to think about the triple aim of healthcare, right? Better individual health, better population health, and then reducing the cost of care. I think there's a lot of opportunity in the healthcare landscape to utilize the power of technology and data to provide that really high quality of care for the most amount of people at hopefully the lowest cost.
If I may, I would like to add something that Mike mentioned, and it's very important. I mean, the access to these technologies into the general population, I think it's something marvelous, right? It's something amazing. Like, for instance, the use of digital devices like the smartphone, right, not only helps with communication, but also these devices now have a huge number of applications that can help monitor blood pressure, record blood sugars, ensure compliance with medications, track the amount of physical activity. I mean, it's amazing the access of these devices and how these can actually help, people around us to improve their health through accessing these different applications. So it's just amazing.
Well, thank you to you all. That was I think just a very great explanation of the many facets of digital health and healthcare innovation. And that's what brings me to this next question, since there is such a depth and breadth of this vertical. All three of you had such an interesting pathway just through your career so far. I'm sure there are steps after this, but up to this point, what steps along the way do you feel really pulled you into the realm of the digital health and healthcare innovation?
I'm happy to jump in here first. I think for me, one thing why I was interested in entrepreneurship and kind of the nonprofit space is I wanted something that was compelling and motivating to me personally, something with a mission that I could stand behind and believe in, and that would wake me up every morning. I think healthcare definitely has that. Obviously, it can be, as imminent as life and death. And so I think it's something, that really matters. And for me, that was important. That was why I started that focus. And I think that in terms of thinking about the steps that I took, that's why I started working with that startup while I was in college. It kind of piqued my interest in what was available. And then just thinking through, okay, now that I know I want to focus on this industry, how can I learn more about it? That's why I went and got my MHA at Gillings to understand, I'm in one very specific sector that at that time more in like the provider side of healthcare. How can I expand that to understand a little bit more beyond that? Because it had the mission piece for me, but then it's obviously very complex and there's so many different sectors, there's so many different industries within the larger industry of healthcare. So for me, it was aligning to my mission and then figuring out how do I learn a lot about this from both an academic setting and then getting myself in the right positions with working at UNC and now working at M1 and kind of the more startup space.
For me, it's a bit of a personal journey. I lost my father when I was 19, and that was really my first true exposure into the full continuum of healthcare. And one of the things that I have firmly believed since then is that our elderly deserve better care and they deserve better access to care. And our children should not be stuck with the bill of our healthcare. And if you take those two, and Katie just talked about the triple aim, if you take those concepts together and sort of where I was in my career 20 years ago when I got into healthcare, it was product development and it was solution development and solving problems. And there are quite a few problems in healthcare, and there still are. Not the same as maybe 20 years ago, but as technology has evolved and our system has evolved, so have the challenges, and we have new challenges now. And one of the things that really draws me to technology is that it's fast acting, to use a pharma term here. And it is one of the few ways where we don't have to rely on policies. We don't have to rely on regulation. We don't have to rely on everyone in the system doing the right thing. These are very, very quick solutions we can put in place that can start to turn the tide a little bit in the right direction in terms of increasing access to care, providing better care, quality of care, improving outcomes, and ultimately making things far more affordable.
These are amazing stories. I think for me also, like Mike, it was kind of a personal journey. I had a close relative that he had some chronic kidney disease, and he needs to go to hemodialysis like every week. And I got a chance to go with him once, and that's where I just got exposed to this environment and how passionate people were with the people going into these different centers, and also how I was exposed to technologies, because at that time, I'm talking about mid-90s, I saw these big machines, right, that extract the blood of the patient and try to resemble the kidney function, right, and clean the blood from toxins, and then got it back to the body. And I was like, wow, this is such an amazing thing, right? There is technology applied into medicine. So that I think was kind of an experience that triggered my desire to go into the medical space. But in terms of steps, right, that kind of a healthy land where I am, I would think this into 4 different things or steps that I took. The first one is to really get to understand what I was passionate about. As I mentioned, I was initially prone to study actually software engineering and computer science, but I also enjoy everything related to biology and medical science. So after talking to friends and mentors, I decided to go into medical school, and also this experience led me to take this path. But and it happens that now I've been able to blend both areas in my career, right? So I could not be happier about it. The second thing is I think I did not limit myself to just one thing, right? So I try to expand my horizon. I was trying to be flexible enough to take new challenges within my domain and even beyond. It's like diversifying yourself. I think for instance, my professional growth within the industry was a result from my desire to innovate and blend information technologies and healthcare with the objective to kind of improve the health of the population. It was acquiring new skills that motivate me to kind of lead projects in which I did not necessarily have experience before, but I was passionate about. And it was also about realizing opportunities and taking advantage of them. I would say the third thing, it's investing in myself. This sounds a little bit selfish, but I think it's something that that Katie talked about. I believe there's no better investment than investing in your education and skill development. So I was once told that you can lose everything, but nobody will take what is in here, right? Last but not least is networking. Networking. I can't stress out how important it has been for me and for landing where I am right now. My first job was a result of a call from a colleague from medical school that I knew that knew about my passion for research. My second job was also a referral from a good friend with whom I did my specialty training. And even my current job was a result of me reaching out to my kidney flagler network. So if you are introvert or shy out there, this is the time for you to learn and master this skill and go out and showcase yourself. So I think these are 4 steps that I took to get where I am currently.
Again, thank you so much. And we have a question. So Chris.
Thank you. Thanks, everybody. Just curious with the breadth and depth of your experiences, and because digital health tech and health innovation is so broad, how would you advise folks getting into the space where to start?
I can take a sorry, Delphis. I thought you were going to speak. So, one of the things that I subscribe to, and I don't know if this is an actual model or something I made up along the way, is I call it the T model of growth, right? And if you just envision the letter T, you can have basically focus on depth and go into one specialized area and effectively get expertise in that. And once you get to a certain, I would say, intersection in your career where you have to be more strategic and you have to learn sort of breadth to better understand the environment and the ecosystem, then you can start to spread out a little bit. The other way to do that is to flip that T upside down, as you basically start to look at what's out there. And as you learn about each of these, you figure out where is your passion and where is the best alignment for you. And you start there and you basically build up the expertise. I took the latter, but that doesn't mean that is the best area. But I always come back to, you have to align your career path with your passion and understanding where not just what you're good at, but what do you love doing? And whatever that is, that's where I would basically start to look at the ecosystem and the types of career paths that are available in that specifically. For me, it was pretty broad because product development could mean so many different things. And where I was able to do is basically do product development in the various segments of healthcare across different types of technology. And that allowed me to say, okay, here's an area where I have some passion and I know it's going to be easier for me to gain some expertise. And now I can hone in on that and gain experience. So I hope that was helpful.
Yes, thank you. Thank you both.
I think in my case, somehow it was quite easy because this is practically the career I chose. I choose to pursue. But I think one important thing, and I want to follow up on what and highlight what Mike mentioned. Again, it's aligning things to what you're passionate about. It's also taking a self-assessment and try to find those skills that are very sought after in the industry, right? And try to build those skills that you need to successfully transition. I believe those are key aspects. And also try to talk as many people as possible in the industry you want to go to. Again, networking is the key, and I did this before, taking the decision to move into the medical career. I talked to a lot of friends. I talked to a lot of people, professors, mentors, and that's where I got my insights to evaluate, again, this possibility of trying to go into this path and try to find opportunities to blend what I was passionate about, technologies and healthcare. So that's what I did.
Yeah, and I would say for me that one thing that I have done, maybe even just like more tactically, is think about in my current role or when I was in school, or things like what am I missing that I really want to be doing? So when I was working in strategy, when I was doing more kind of consulting work, I was thinking, I really like this. I like the strategic thinking part. What I feel like I'm missing is seeing where it goes from here, because a lot of times in more consulting role, you pass it off, right? And so I was like, oh, how can I get closer to that next step? Or, it's great being a state employee and working for a large organization because you can have a really big impact. But I was thinking, well, I'm younger in my career. I kind of want to go someplace where I know I can grow faster if I want to, like a startup. And so that was another piece where I thought, okay, let me transition to a startup. So kind of using some of the pieces of where am I feeling like a little bit of maybe discontent in my current role that I can look for in a future role. Help me steer.
Great. Thank you, everybody. Any questions at this joint before we go on to another moderated question? All right. And is it Raheem?
Reem, sorry, I'm not able
Reem?
to put camera, but Reem,
Sure.
yeah. I just was wondering if the panelists, do you guys have any recommendations for good healthcare news that you follow to keep abreast on innovations and political things and anything going on in healthcare?
And I hate to tell you, that is our last wrap-up question.
Oh.
So if you'll hang on, because we've
I
been
will hold
asking
on.
every panel, because that is so important. But great question. And we will have that at the end so that everybody can write them down. And so have your paper and pencil handy for that. But thank you for that question. All right. And the answers I think you all just gave really, if they feel lead to my next question for you. The fact that, we always tell students gain these skills, gain that skill, but what they really want to know is day to day in the real world, what skills, abilities, and experiences do you regularly use the most that really, really make a difference in your career today or throughout the steps that you've taken to get where you are?
If I may, I would like to start. I think there, at least for me, there are 4 main skills that I used quite often in my role and in the previous positions I've been at. I would say the first one is communication skills. I really cannot stress how important it is to properly communicate your ideas on a clearly basis in writing and in presentations, especially if you're in front of C-suite or executives. If you want to have your ideas to kind of resonate, you need to convey your message properly. So communication skills, I think it's number one in my list. Number two, I think it would be management without authority, or probably the ability to work cross-functionally. This is especially relevant in the innovation space. You definitely won't have the ability nor the time to do everything all at once, right? So you need to partner, you need to collaborate cross-functionally to get things done and move the needle. So and sometimes in kind of a new roles, right, that are open for you, and you need to figure out things. You need to figure out how to ask for things in teams that are kind of beyond your responsibility, right? So again, management without authority it's kind of a key. Negotiation skills, I would say, would be the third one. If you're partnering with several teams at the time to get things done, then you will definitely use this skill quite often, because partnering requires finding benefits across the spectrum and persuading people to believe in your vision. So you are in constant negotiation to get things done. And last but not least, I think analytical skills overall, have the ability to have this situational analysis, right, and also data analytics as a hard skill. So I think this is probably one important one in my case. Has been someone that has been exposed to apply statistics and biostatistics for research purposes, but this has been something that has helped me in my career big time. I still run data analysis as a part of my role, and I still collaborate with in research. So data analysis has really opened the door for me.
I think Delphis did a great job kind of highlighting all those soft skills, right? It's you know, you can encompass that into having emotional intelligence as well, and being able to work cross-function. So I'm going to get a little bit more tactical and kind of build off his last one, which is a hard skill. I think analytics and informatics is key. So for those of you who are in statistics right now and hating it, I'm sorry. You have to learn that, because you are going to apply the crap out of it. Understanding economics is a huge one as well. And you kind of combine the two with healthcare. We have this field called medical economics right now. And in the past, it was kind of thrown in with the actuaries, it was thrown in with the analysts, so on and so forth. But right now, it's sort of a path of its own called medical economics, which drives a lot of the decisions that are made in healthcare right now. And so I think those are crucial. The other thing that I would advise, if you're going to get into healthcare, domain knowledge is going to be very, very important. I think just having understanding of concepts that you're going to be able to apply in healthcare are great. But in order to truly understand the impact and effect of those, you have to have domain expertise. And so to kind of jump back to the question that was asked earlier, which we're going to address later, I'm happy to share some publications with you via email or however that I basically subscribe to, just to keep myself up to date on what's going on, because I think having that industry knowledge is going to truly differentiate you from anyone else that's going down this path.
Yeah, I would definitely second that. Staying on top of trends as much as you can is always going to be helpful. Staying curious, staying inquisitive about different topics, I think will serve you well. And then one thing that I have found is a really helpful skill, and something I'm always kind of making sure that I'm doing as I'm thinking through what can be helpful, how can I make sure that I'm learning a lot, but also getting, the knowledge from people that know more than I do, is to, before I go and ask a question about something, do what I can to give them something to react to, right? To make sure that I can do even a minimal amount of research just to understand, okay, this is really what my question is, and this is how I think I'm going to answer it. This is the direction I'm headed. And that way they have something to react to. I think I've found that works really well for getting kind of the right answer you're looking for and better direction from those people that might have more knowledge and be able to fill in there.
These are great pieces of advice, and very important, I feel, as we might have current students here or folks that are in the middle of their career looking to gain further skills. So very much appreciated, very well stated, and really the balance of the soft skills and more of the technical skills that you all spoke of was, really helpful as well, so that everybody remembers to kind of look at both as you're gaining your skill sets and honing those. Are there any skills or experiences that you wish you would have, learned or taken advantage of while you had the chance? And that, again, could have been during your education or maybe along the way, that you see, like, as you got in, you might know them now, but it could have been so much easier if you had gained those prior to kind of jumping into your field.
I can just say that one thing that I think is helpful to take advantage of when you're a student, and I did this as an undergrad, is just like reach out to people, say, hey, would you like any help? Or, hey, can I like talk to you about what you're doing? People are usually really receptive to students. You're not a threat, you're not competition, so I feel like it's a really good opportunity, even just to reach out and do some of those type of networking activities, I guess you could call them that. And then one thing from me that I kind of wish I had done more of, I didn't go in undergrad knowing, oh, healthcare is absolutely my focus. I didn't come from a big background of, healthcare on the clinical side. So I would be, if I were to go back, I'd get a little closer to that clinical side to kind of see what it's like from a patient perspective, because there's only so much you can gain really from, hearing that feedback, but being able to be in that setting more, I'd probably spend more time doing that.
No, I think that the networking is a great one. That's the one I was going to start with, because one of the things that I regret not doing is doing more networking while I was at UNC, as well as during my undergrad. The other thing that I kind of stumbled upon and was very fortunate was having a mentor. And I think that is something that a lot of us don't think about early on in our career. For those of us who are fortunate enough to find someone who will mentor us, that's a great step forward. So one of the things that I was very fortunate about was finding mentors in that space. And, Katie makes a great point. I'm not a clinician either. I don't even play one on TV, or couldn't play one on TV, but being able to have those mentors that have been nurses and doctors and have gone through that journey, understanding what their journeys have been like, what is their day-to-day like, kind of goes back to gaining some expertise in the domain and understanding everything, getting sort of that 360 point of view of the industry. So those are two things that I would just focus on. But in terms of the academic side, the one class that I actually went back to take was the negotiation course. I did not take that while I was going through the MBA program, but I went back to take it. I thought that was a really good course in terms of, kind of going back to a point that Delphis made early on, is you're going to have to do a lot of that as you're getting into healthcare, because it's so broad. Everyone is, there's so many different verticals. Everyone has sort of their own initiative and their own agenda. And you have to have that ability to negotiate, to just kind of get everybody on the same page and march to the beat of the same drum.
I think Katie and Mike they have really stated some of the things that I was also thinking, but there might be probably a couple more that just came to my mind that I would have loved to gain when I was in grad school. I'm thinking about my recent experience at UNC. Now, these are not necessarily taught in a formal class, but I think I think it's related to the experiences that that I might probably would have identified as ways to learn things. Like, for instance, I wish I could have mastered the ability to act without knowing all the details and confidently take risks, right? this is something that you don't necessarily get into in a class, but I believe this is something I learned by participating in the START project. Those that are in the MBA program probably know or have heard about this, or by taking courses in other countries like the Vienna Innovation Program, in which I was exposed to another consultative project. So I wish I could have participated in more of these hands-on real business challenges, resolution projects that will help me kind of think and center my thoughts on how to resolve these kind of business problems and act without knowing all the details. And last but not least, this is just very personal. It's more concrete, but I wish I could learn more about financial tools and corporate finance indicators and concepts so I can better understand the financial environment at the corporate level. But if you're planning to move into the corporate level, even in the healthcare industry, I think it's important to know about these different indicators and learn a little bit more about how this financial aspect works in healthcare.
Again, panel, thank you so much for the advice. And again, I'm going to pause for a minute because I'm sure that folks in our audience have some questions.
I have a quick question. I think that was a great question about skills development during your education. Thank you for the answers. I'm just curious, what does that look like for you now as you enter like corporate structures or have a busy work life? What does that skill development look like now as you're working full time?
Well, I can give that a shot. I think for me, it's in a few different ways. One of them I would call it circumstantial, and it's as a client comes to us and they propose a problem or a challenge they have, and we don't know all the details or don't have all the details about what they're facing or their segment of the industry. That gives us an opportunity to go out and educate ourselves, right? So that's sort of an ad hoc, and we'll go out to the publications. We'll go to things like LinkedIn Learning. We'll go out to a lot of the various public websites as well as university websites to see if there's any published papers on it. So those are some of the things that we'll do on an ad hoc basis. On a personal level, I always, just like anyone else, I set goals for myself in terms of what are some of the things that we want to do. So this year, for example, is not healthcare related, it's marketing related. And it's something that we're trying to do with our firm is we have pretty aggressive goals this year. So in order to do that, we have to get better at marketing, which is not going to be a huge challenge for us because we've never done marketing before. We've been pretty fortunate. The business we get is word of mouth, but to get beyond where we are right now and kind of hit that next threshold, we'll have to do. And so for me, it's about, can I go take some online tutorials on things? Can I go and look at some of the studies that have been out there done on what is effective marketing for a consulting firm that is very, very niche and specialized? So it's really just about, again, for me, speaking personally, it's either ad hoc and it's something out of necessity that we have to do. And we carve out the time and we go out there and do the research, or it's based on goals that we set for ourselves.
So, Christopher, thank you for your question. And I think I would like just to add an important aspect, and I think it has been mentioned, but it's just, at least for me, is trying to keep myself up to date in things that are happening in the field. This is something I learned, especially being in the innovation field. People just come to you because they want to learn what's out there. So you are required to be up to date on the latest developments on what are the trends in the industry. And when you are in meetings and you are around executives, every time someone talks about new developments, they turn to you, right? I've learned that being keeping yourself up to date and learn those trends and has some numbers in place. It is being really useful for me.
Yeah, and then I work for a growth stage startup, so I feel like every single day I'm building a new skill, because with a small company like that, you wear a lot of hats. But it's definitely something where, you know, sometimes I'll be having to lean in. It's a data science company, so we have a lot of, you know, data scientists and engineers that are more technical in their role, but there's definitely things where I'll have to lean in and think about, oh, how are we setting up, you know, our control groups? How can we communicate that to our customers? And you know, that's back to Mike's point about leaning into those stats courses and like understanding how can I bring back these skills that I had before, and you know, I don't have to go too deep in that. We have the experts, but how can I make sure that I'm still building those different skills? I think maybe that's one thing I found, at least, of being at a startup. It's easier because I have to. But it's definitely, there's things that I've tried to be intentional with a group of like-minded people that I work with of, oh, you know, even something as simple of like, how do you make sure you're advocating for yourself? Like, how can we talk about the best way to think through an idea so that we can all be heard in the conversation and move forward and have constructive feedback from that. So I think there is always going to be something that is a bit on you to make sure you're developing the skills that you need. But I have found that the startup space is great for developing skills you didn't know that you would ever need to use.
Awesome. Great question, CJ, and thanks. Great answers as well. Sagar has a question.
Yeah, thank you. Thanks everyone for taking the time today. So I wanted to ask a question, I guess, that fits the general sense of the digital theme. Is in your sense, do you feel that since COVID, there's been an explosion of digital health innovation and thought leadership, and a lot of entrepreneurs are trying to enter that space? Do you see that we're approaching maybe like a .com boom type bust? And there's a lot of there's a lot of money out there. There's a lot of capital, a lot of ideas, but is there a certain trend of companies that you see succeeding, where others are maybe either floundering or failing in what you're seeing?
I'm happy to take this one because we deal with quite a few startups, and I think you hit it on the head. I wouldn't say it's a .com boom right now. It's getting to that point, but we're also starting to see the cliff as well. And a lot of this is because anytime that you have such a drastic shift in paradigm that we experienced with COVID-19 pandemic, there's always going to be a lot of innovation happening, right? Necessity is the mother of innovation, and that's what we saw. But what you're starting to see right now is a lot of investors, a lot of the buyers out there are starting to realize that not all of the solutions out there are equal, right? Some organizations and a lot of investors, unfortunately, get into healthcare space because there's a lot of money to be made. And they will stand up a company, they will stand up a product with a lot of promises, and they don't necessarily deliver. And so that's the unfortunate part of it. And that's one of the reality that we deal with, is that you're starting to see a lot of these solutions out there that have great promises, they're starting to fizzle out. And so for those that are successful, is those that actually basically put their money where their mouth is, right? They are focused on the product, and they're focused on the value proposition and what that product is going to deliver. They are the companies that are actually investing in the science, that are investing in the technology and doing it the right way. They're doing it in a compliant way, and they're focused on patient outcomes. They're focused on improving process, making things more efficient. Those that are starting to, come out and you see some of the projections in terms of what their valuation is, or how much they can reduce healthcare costs by, or how much they can make things more efficient. You're starting to see a lot of these companies just basically get into a bit of a challenge with raising more capital because they have not been able to produce the outcomes they processed. And so, I will put Katie on the spot and have her talk about this, because I actually deal a lot with these informatics type companies and that are doing a lot of data sciences and decision support systems. And there are a few out there that are really, really good. And they're starting to address some of the hot topics like social determinants of health, mental health, maternal health is another one that's out there right now that's really, really big with the Medicaid population. But those are, some exceptions out there. Unfortunately, there's a lot of these that are out there that are saying they're doing things that, honestly, when you pop up the hood and look underneath, the capabilities simply don't exist.
Yeah, I think there's definitely been a readjustment of, supply and demand, right? There was kind of I think, expectation that we might stay more virtual than has become the reality in our, I don't know if we can call ourselves post-COVID, but kind of not the same type of environment we were when COVID was at its highest, right? So definitely seen that across some of the peer companies in, definitely in Boston, but even in just this kind of realm of the startup world that my company is in. I think that one thing, back to your question around, like where are the ones that are going to stick or that have maybe the most chance of sticking? One thing that I know that we have tried to do at M1 Health is stay aligned to the incentives in the current structure. I think sometimes I get pretty frustrated at the way the healthcare system is set up, but you have to work in those confines, right? In order to make sure that what you're doing can be successful. So we work with a lot of the payers, a lot of the plans, and part of the reason for that is because that's where the money is for these types of incentives when it comes to the social side of healthcare, because they are at risk for those populations. So I think the ones in my view, too, and no one can really predict where things are headed, but that is probably the ones that are going to maybe have a better chance here, because that structure isn't going away within the next few years. Now, I do think there are changes in how we're starting to think about healthcare and healthcare reform, of course, but it's definitely a longer term play there.
May I just add on something that Katie mentioned, which I think is very important. As we mentioned in the beginning, healthcare is big. There's so many verticals out there. You have to understand the ecosystem within that you're going to operate. And if you don't understand that, you're setting yourself up for failure. And this is where you see a lot of the other companies failing, is they build a product in silo and they're not thinking about the broader ecosystem, the other processes, the other technologies that they have to play with within a healthcare setting. And so that's another thing that's going to be very, very important if you're trying to aim for success, which I'm sure everyone is. That is one of the things that you have to understand is what is going to be the application of this. When you implement this into, say, a payer or a hospital system, what other processes you have to integrate with, what other systems you have to play with.
I just would like to mention that as Mike and Katie said, necessity is the mother for innovation, right? And in the pharmaceutical and life sciences space, I think the use of this amount of digital data that has been gathered through the application of these different tools and products that may collect patient information remotely through the implementation of telehealth and telemedicine, right? Everything, it's moving towards real world evidence analytics, and that has actually shifted the paradigm of therapeutic drug development. For instance, there is a growth and ability of an availability of multiple enriched data sources, and the scale of response in the industry, it's very high by pharma companies. So and that will change the way we do research, for instance, right? So yes, I think there has been quite a game changer with the experience we have had with COVID-19, and I think it will keep just moving on.
Awesome. Thanks all for that comprehensive response. Appreciate it.
Absolutely. And in that response, you all have answered at least another couple of the questions that I had, as moderator questions, especially kind of where you see, digital health and technology moving. And I think that was a not only comprehensive, but a realistic response. So appreciated, for those answers. I do have one quick question prior to Reem's question that we're going to wrap up with. But as folks right now are losing positions in the technology world, and they have maybe no background in healthcare whatsoever, but might start seeing some opportunities within healthcare in the digital space, how do they translate their experiences and background and add to those to be able to move into maybe the healthcare space, which might have some more available opportunities in this arena? And just a quick, from each one of you guys, a quick response would really help, because I know that we have some folks, alumni, et cetera, that might be in these positions.
No, I'm happy to start here as well. I think, I went through this journey 20 years ago when I transitioned into healthcare. And for me, it was coincidence, right? I was working on the technology, and the types of technologies I was working with were starting to emerge, and the types of things I was doing were starting to emerge in healthcare. And so the opportunities presented themselves to me. But I think there is some sort of rationale in there. If you think about what you're currently doing, things that you're doing really, really well, think about areas in healthcare where you can apply those same types of skills, right? And if you're a programmer, for example, and you've done something really, really neat and cool and specialized in a different segment, there are likely opportunities for you to apply that in the healthcare segment. If you're in security, for example, my God, there's so many opportunities for you. Security, compliance, things like that. Data analytics, there's so many things that you can simply apply into healthcare. So I would just focus on the skill sets that you have, or skill sets that you're looking to obtain as you're going to school and where you want to go, and how can you apply those within the healthcare segment. And I guarantee you that there is opportunity to do that in just about every sub-segment and subcategory of healthcare, because it's so vast. It's a world of its own. So it's just a matter of understanding that, and then going back and obtaining some domain knowledge about how does everything work? How does what you're doing and applying to healthcare going to impact? And again, how does it play with the ecosystem that you're going to be playing in?
Yeah, I would say definitely, being able to take any skills that you have that translate well into this industry. I know that at our startup, we hire a lot of people without healthcare background, especially in a technical facing role. I think some of those skills are pretty transferable. And I would say being ready and willing to Google a lot of acronyms, learn a lot of things about healthcare, and just kind of like dive in. I think as you probably know, if you're trying to transition into a new industry, it's going to take some of that like self-directed learning to get up to pace, but certainly I've found it to be doable.
Making a career pivot, it's a major move, a special move into healthcare, in which it's a complex industry and have many actors and factors influencing industry direction. So besides what has been said, I think, again, talk to as many people as possible in the industry you want to pivot to. Again, networking, it's key in this exercise of trying to learn a new industry, and also consider roles you would like to land based on your previous experience. Again, it has been said, try to relate and align your current skills and experiences to the industry. I think that's very important.
Terrific. And thank you so much. And I'm sure there's many out there in this audience and who will listen to the recording that will be very thankful. And then finally, I would love everybody just briefly, if you could tell the audience what resources, books, online publications, books that you use every day as resources to keep sharp or just to be enjoyable in your career. So I'll give everybody that last word and then we'll wrap it up.
I can jump in. I really like Kaiser Family Foundation for an online resource. They're really good to follow. They make a lot of things that are quick to get up to date on things. A newsletter I like is Axios Vitals. And then a one that is really popular at my company is called Health Tech Nerds. It's another newsletter, so might appeal to some of you.
Awesome, thank you.
Again, I'm happy to share a more comprehensive list because I've signed up to probably about 50 different newsletters, and I do go through the headlines at least every morning. Axios is a great one, by the way. Kaiser also, especially if you're looking for stats on healthcare, Kaiser is a great one. I also go to cms.gov. That's where I sign up to basically get the latest on health policy. That's a great one. Also, if you go to data.cms.gov, that's also a great place to get free data and also some of the statistics. In terms of publication, Fierce Healthcare is a great one. And then Becker's Hospital Review is another great one that I subscribe to. And then I will also, as I mentioned, I will send a couple of books that are about sort of trends in healthcare and transformation in healthcare that I think will be very, very beneficial. So I'll share those after the call.
I just would like to add to the list of resources that has been set. Healthcare IT News it's also one site that I use to just learn about what's happening out there. And in terms of books, I recently got into this book, Productive Tensions. It's written by one of the professors in King of Flagler. It's Professor Bingham. If you have taken the strategy course, you probably might have known him. But this book, it talks about how can we tackle innovations, toughest trade-offs, and it's very interesting. So I would highly recommend this one.
Terrific. Again, thank you so much. And thank you, panel, for being here tonight. I know this is time out of your schedule, and also it's Fat Tuesday. So hopefully everybody's got some tasty snacks to dive into after this. So you're extra troopers for being here this evening. But thank you, audience, as well. And we hope you'll join us for our next fireside chat that's coming up pretty soon. And so just check our schedule for that one. And again, have a great evening. Everybody stay safe and enjoy, and we'll see you soon.